Hello everyone, I am Dr. Kona Lakshmi, Robotic, Minimal Access and Bariatric Surgeon, Yashoda Hospital, Somajiguda. We have seen a significant improvement in the technology as far as our surgery goes from the era when we were doing surgeries through the open method. Then we progressed to doing surgeries minimal access way, or what we call the laparoscopy way, where we make 4 small holes and put fine instruments to do the surgery. Now Robo has come as a major surgical advancement in the same minimal access surgery. Now the same 3 holes, the surgery is done, but here we use Robo, which has a grip on all the instruments, so that we are not individually handling each instrument with different hands, but one Robo will handle all the instruments, and we as a surgeon will sit at the console and move the instruments. So the movement becomes very fine, because in this technology the human hand tremor or the movement is totally cleared out. So it becomes a very smooth movement, and there is a magnified 3D vision. So we can actually feel that we are looking into that organ and operating. So that gives us the minutest details of the organ structure, and if there are small blood vessels, which is natural in a living being to have multiple blood vessels running through the tissues. So this magnification will help us to control and avoid bleeding through the small blood vessels and minimize the blood loss which can happen with any surgery. And not only that, because the movement of the instruments is very fine, cut through which these instruments go into the abdomen doesn't get move much. So the post-operative pain after the surgery is done is almost very minimal. So that reduces the need for a lot of painkillers, and the person who has undergone the surgery can immediately be up about, start walking, and by next day they almost say that we don't feel any pain. Now this is the advancement. When we are doing major surgeries, we want the person to be very comfortable after the surgery. We don't want much blood loss to happen during surgery, and we want the person to quickly go back to home after and return to work after surgery. That is the advantage we have got now with the surgical robos, and we at Yashoda have the highest technologically advanced robos, the Intuitive XI Robo, which is the best in the world, and that gives us a lot of definite edge over other robos which are available in the country. And definitely we feel with the more sophisticated technology, the surgeon and the patient benefits. And coming to my specialty, for me the Robo is very helpful when I am doing complex GI surgeries, and when I am doing complex hernias, large hernias, recurrent hernias, or elderly people with hernias, or obese people with hernias. There definitely this robotic technology I have seen, as I have been doing these same surgeries laparoscopically till recently, but when I switch to doing them robotically, I feel that yes, I am doing a more finer surgery than what I was doing with the laparoscopy. Laparoscopy has its advantages, and Robo adds a better advantage to this. Similarly, when I am doing a very obese patient bariatric surgery, earlier I personally had to take the whole weight of the person on my arms when I am operating, say 150-200 kgs, and then have a stable control on the instruments to do the bariatric surgery. We could be able to do those surgeries, but now yes, with the Robo I feel more comfortable that I am doing the surgery, but I am not physically facing the patient's weight on me. So that reduces the fatigue or the surgical tremor which can happen when you are handling that heavy person's weight on your instruments and doing the surgery. So with time and change in technology. This has brought us a very good improvement in our surgical expertise, and I definitely feel that more and more people should opt for robotic way of getting their surgeries done, and definitely you will feel the difference, and we will be able to have more cheerful and more happy patients on the next day after surgery and get back to your work as early as possible after the surgery. Thank you.